Welcome back, my friends. This is Lindsay coming at you with another work from home job lead. Today's job lead is going to be a little bit more specialized for those of you who already have healthcare experience, healthcare billing experience, but it does pay very well. So real quickly, before we dive in, just a few reminders. I do not work for any of these companies. I simply share what I find online. So you will have to contact them or ask additional questions at the time of the interview. And if you're interested in these positions, the links to apply are always in the description box below. But today's job lead is brought to you from the company Larval. Now, this is a part-time position and the pay is anywhere from $25 to $30 an hour. This is for my United States folks only, but Larval is looking for a Medicare claims data analysis to work part-time. This is a 1099 independent contractor role. So as a Medicare claims data analysis, primary responsibilities will be to ensure that the data platform is validated, cleaned, and ready for any reporting and analytic work. So you will gather and analyze healthcare data from multiple sources, CMS, which is Medicare, medical claims, pharmacy claims, patient-provider behavior, and extract the trends and provide business insights. You will understand the data structure to assist with developing SQL and SAS codes to store, sort, and retrieve data. You'll obtain and integrate data from the data warehouse. You'll convert codes to open sources like R and Python as required, and you'll perform and document data analysis, data validation, and data mapping design. So they are looking for someone who has a minimum of 3 years experience working with and understanding Medicaid and Medicare data, including data extraction, data manipulation, and building and data interpretation. Now, this does require a bachelor degree in either STEM, the STEM, the sciences, public health, finance, economics, or some other related field, experience exploring and extracting a plan encounter data from CMS, someone who understands healthcare drug codes, diagnosis codes, and procedure codes, someone who has strong analytical and validation skills, and someone who is a self-starter and can work independently. But if that sounds like you and you are looking to pick up part-time work to make some extra side hustle money, it does pay up to $30 an hour, but the lowest it'll pay is $25 an hour. And of course, the pay between that is based on experience. It is 100% remote. You can work anywhere in the United States. It does not have any state restrictions, and they are offering at this time 10 to 20 hours a week. All right, as always, if this job lead was not for you, that's okay. Please feel free to leave in the comments anything specific that you're looking for, along with any education and experience that you have. I'm always reading that and keeping that in mind when I am searching for job leads to share, and I'll be back really soon with more work from home job leads just for you. 2 videos will be popping up on your screen. One I picked for you and the other YouTube picked for you that you might enjoy next. Please subscribe and hit the bell icon so you never miss another work from home or money making video from me. Thank you so much for watching, and I'll catch you in the next one.